banned in New Zealand. Now scientists saying that there is grave doubt about whether this is going to destroy and harm children, especially their thyroid. And we have nobody independently testing for us and saying to us, this is bad or this is good. I don't know of a period in our history when so many things that you and I believe in are under attack. And we're in a fight of our lives. We're up against the great multinationals, I don't even know what to call them anymore, imperial companies, worldwide companies. You know much more about that than I do in your business. But in the end, there's nothing we can do because we can't live globally. You live in the morning, you get up where you live. You have to look after your family, your country, your company, wherever you work. We can't think around the world. We have to think of where we are. And all of us together will have to do the same thing we've always done. And we can never stop doing it. We have nobody else to go to except ourselves. I've seen people everywhere. I saw them the other day in Quebec City. You see them everywhere. They agree with us. They believe with us that we can make a better world to live in. That we are not willing to sell everything that we have worked for over half a century. And I'm pleading with you today. And I know how hard you've worked. My God, that you have worked so hard. But we have never stopped asking people to work just because they've worked hard. And I'd have to say to you, what alternative do we have? You can take a beating, and they're not nice. I remember when my father was defeated in 1964, and he said something that night in defeat, on television and on the radio. He said, "Fight on, my men," said Sir Andrew Barton. "I'm hurt, but I'm not slain. I'll lie me down and bleed a while. Then I'll rise and fight again." And my father's secretary said that she didn't think they had ever received so much mail, so many phone calls, and such a sense of shame by so many people about what they had done. And they lost him out of that province. But the great thing I learned watching him, all the years and the things that I've seen happen to him, I never saw a bitter man. My mother and I would become quite Irish and very, very upset. And he always said, they're entitled to their vote. And what he said to you and many other people many times: courage, my friends. 'Tis not too late to build a better world. And I want you to just, I brought a tape with me of the last time he spoke in 1983. Just so some of you can see, all of you, I mean, some of you are very young. I'm so excited that so many of you are so young here today. And this is the man that so often you've heard about. and what the health system meant to him. And so if they would just push the tape, it will play.
That's your number one task. And the second is, again, it's been mentioned, to save Medicare from subtle strangulation. And when you go back to your constituency and you run into somebody who says it's a good idea for you soft-hearted humanitarians, but we can't afford it, let me give you a simple statistic which you can put down on a piece of paper and carry in your head. And that is that our friends in the United States are spending 9% of their gross national product. And they get a higher per capita gross national product than we do. They spend 9% of their gross national product on health care, and 34 million of their people have no health care coverage. And in Canada, we spend 7% of our gross national product, and every man, woman, and child in Canada is covered under Medicare. But I want to warn you, as one who started out even before I was in politics, dedicated to the idea of comprehensive health insurance, fought for it through all my political life. I want to say to you that Medicare and hospital insurance are already marked for destruction unless you stop the per capita taxes and the extra billing which most of the governments of Canada are now permitting. Someone said, well, what harm can it do? What harm can it do? A per capita tax which is levied without any basis of ability to pay. A woman in Ontario with 2 children having to pay over $50 a month, $600 a year. Can she afford that? And that's levied on the basis, on a per capita basis, not on the basis of ability to pay. I know you need money to run Medicare. Al Blayton and I can tell you something about the cost of that. But if we need money for Medicare or for any other humane service, let it be financed on the basis of ability to pay and not on so much per head.
Bye-bye.